here we go and compare and contrast about some gastrointestinal disease. These three diseases is the sign symptom is almost similar, but there's some different as well. So we must have to distinguish actually what are the differences between ulcerative colitis, Crohn disease, and diverticulitis. These three diseases are commonly attacked in our gastrointestinal system. Before to go and discuss these three diseases, I'm going to show you what are the different parts of GIT or gastrointestinal system. If we go and have a look in this small picture, everybody know that, but still I want to recap it. So we are going to talk three diseases: ulcerative colitis, Crohn disease, and diverticulitis. These three actually inflammation of the bowel disease, inflammation of the colon, right, or bowel. So in this picture, this one is called esophagus, right? And then this portion of the stomach, continuation of the stomach, duodenum, then small intestine. This you can see the square inside. This is the small intestine. The terminal portion of the small intestine is called ileum. The ileum is here. Ileum met with cecum, and this area basically is cecum. After cecum, the large intestine started. This portion is called ascending colon, transverse colon, and descending colon and rectum, right? So the ulcerative colitis, Crohn disease, and diverticulitis, all of three attacked our bowel, but in the different location of the bowel. Okay, let me go back in the here. Ulcerative colitis, it is the inflammation of the colon that causes the continuous lesion or disease. So ulcerative colitis is the edema and inflammation, especially the, I said colon, but which portion of the colon? Basically terminal part, and terminal part is the rectum or rectosigmoid colon. Terminal portion, especially the rectum or rectosigmoid. It is the inflammation and edematous change. What about the Crohn disease? Crohn disease, you see, also inflammation and ulcer developed. Here the inflammation and edema, also it is occurring in the rectum or where the rectum met with the sigmoid. Here it is gastrointestinal tract, often at the distal ileum. It is called distal ileum. So the Crohn disease is an inflammation and ulceration of the small intestine, basically ileum. So they causes the sporadic lesion and risks to develop the fistula. What about the diverticulitis? It is an inflammation and infection of the bowel mucosa caused by bacteria or food or fecal materials stabbed in one or more diverticula. Basically, diverticula, it is the inflammation of diverticula, diverticulitis. Diverticula means the extra sac formation in the intestine, and that sac we called diverticula, and diverticula when infected by bacteria or food or fecal material, inflammation occur in diverticula, and that is called diverticulitis. And diverticulitis can perforation sometime and causes peritonitis. What is peritonitis? It is the inflammation or perforation, right? So if I go back in this picture here, so according you see the Crohn disease, ulcerative colitis, and diverticulitis. So ulcerative colitis, I said inflammation of the colon, especially the terminal portion, rectum or sigmoid colon. It is ulcerative colitis. When patient ulcerative colitis, usually patient complain of the pain in the lower left quadrant with fever, right? And here, Crohn disease, this is the inflammation and ulcer developed of the small intestine, especially the ileum. This is the ileum, terminal portion of the small intestine. Okay, and also chance to develop the fistula. It is the Crohn disease. Usually, patient complain the pain in the right lower quadrant and also fever. The diverticulitis, I said, it is occur in the bowel or GI, but extra diverticular sac formation along the bowel. And when the diverticula or extra sac is infected, it is called small pouch in the colon, and this is called diverticula. So inflammation of the diverticula is called diverticulitis, and the diverticulitis can perforate and causes peritonitis, and peritonitis is a dangerous basically. Also patient complain the pain in the left lower quadrant. So my friend, the ulcerative colitis and diverticulitis, pain in the left lower quadrant, but Crohn disease, pain in the right lower quadrant. This is the compare and contrast. So now go little bit here in the top. I said now go here, ulcerative. In severe cases, it can involve the entire length of the colon. Mucosa and submucosa become hyperemic. What is the meaning of hyperemic? Means increase in blood flow. And colon will become edematous, redden. That can lead to abscess formation. And edema and thickness of the bowel mucosa can cause partial bowel obstruction or intestinal mucosal cell change can lead to the colon cancer, or insufficient production of intestinal factor result in insufficient absorption of vitamin B12. So when vitamin B12 deficiency occur, because of vitamin B12 deficiency, the red blood cell will be immature and broken easily. When red blood cell broken easily, the hemoglobin also go down and patient develop anemia. If anemia develop because of vitamin B12 deficiency, it is called pernicious anemia. So the pathology in the mucosa, and the mucosa does not absorb the vitamin B12 from the food, and deficiency of vitamin B12 lead to develop anemia, and this anemia is called pernicious anemia. So in case of ulcerative colitis, what kind of anemia develop? Pernicious anemia develop. Ulcerative colitis, abscess formation if it is untreated, right? Where the pain? Left lower quadrant. Patient also complain with fever. Crohn disease. So all the bowel layer can become involved, or it is sporadic. Fistula are common. Crohn, if it is untreated, fistula develop, can involve entire GI tract. Malabsorption and malnutrition can develop when the jejunum and ileum become involved and require the supplementary vitamin and minerals, possibly including vitamin B12 injection here as well. In case of diverticulitis, infection and inflammation. Not all clients who have diverticulosis develop diverticulitis. So I said the pouch, small pouch formation in the colon, and this pouch or sac we call diverticula. When diverticula is inflamed, it's called diverticulitis. So not all clients who have diverticulosis could develop diverticulitis. Diverticula can perforate and can cause peritonitis, right? Or severe bleeding. So peritonitis basically complication of diverticulitis or ulcerative colitis or even Crohn disease. So peritonitis, sometimes patient got hospitalized because of peritonitis. Okay, so I said now, so diabetic or perforant even can cause the bleeding. So peritonitis basically inflammation of the membrane lining of the abdominal wall or abdominal organ, whatever it is. Now go for the sign and symptoms, compare and contrast. In case of ulcerative colitis, you see abdominal pain, ulcerative colitis. Diverticulitis, acute onset of abdominal pain. Also, patient have a pain and fever. It is a common sign for ulcerative colitis, Crohn disease, and diverticulitis. Only define the location. Ulcerative colitis has a left lower quadrant pain. Diverticulitis has a left lower quadrant pain. But Crohn disease is a right lower quadrant pain. Why right lower? Because they attack the small intestine. Okay, and small intestine terminal portion basically on the right side. Whereas the ulcerative colitis, they causes the inflammation of the colon, especially the rectum. It is the left side. Okay. Also diverticulitis, left lower quadrant. Patient has a anorexia, weight loss. Anorexia, weight loss, nausea and vomiting. Right? So anorexia, weight loss, common for ulcerative colitis and Crohn disease. Nausea and vomiting, diverticulitis. In case of diverticulitis, physical assessment findings. So when you examine your patient, you can see body temperature increase, fever, and fever. So ulcerative colitis, Crohn disease, diverticulitis has a common problem: abdominal pain, anorexia, weight loss, and pain. What about here? Diarrhea, right? So they said the diarrhea also common Crohn's disease and diverticulitis as well. But in case of ulcerative colitis, the diarrhea usually 15 to 20 liquid stool per day. When whatever the Crohn disease, they have diarrhea, but not that much. Frequency is less, and it is 5 low stool per day with mucus for passing or pus formation, right? Also abdomen distension, tenderness, also in the Crohn disease, right? So they said bowel sound, high pitch, rectal bleeding. Crohn disease also bowel sound, high pitch, but no rectal bleeding, steatorrhea. Steatorrhea means stool mixed with fatty tissue, fat. Whereas the diverticulata do not have any rectal bleeding or steatorrhea. They have a fever, chill, and tachycardia. So, but keep in mind, if the diverticulitis perforated, patient come with the peritonitis. I said. So if patient has a peritonitis, usually patient present with abdominal pain or tenderness, bloating, or feeling of fullness, or fever, nausea, vomiting, or even diarrhea. What about the laboratory test? What are the difference between laboratory test about all of them? So here we go. You see the red color, blue. So red color here is almost same. So laboratory test ESR, erythrocyte sedimentation rate, WBC, and C-reactive protein. So in case of ulcerative colitis, ESR increase, WBC increase, C-reactive protein. Same as in case of Crohn disease, ESR increase, WBC increase, C-reactive protein increase. So when patient has an infection or inflammation, WBC always increase. Because of inflammation, C-reactive protein increase as well. ESR increase. In case of diverticulitis, ESR increase, WBC increase. But you see the C-reactive protein is not increased here. In case of Crohn disease, we see anti-glycan antibody should be increased. Okay. In case of, now go here, as hematocrit and hemoglobin decrease, serum albumin decrease, magnesium, potassium, calcium decrease. So in case of ulcerative colitis, Crohn disease, and even diverticulitis, the common findings, hematocrit and hemoglobin decrease, serum albumin decrease, electrolyte decrease, right? In case of Crohn disease, folic acid and B12 decrease. In case of diverticulitis, hematocrit, hemoglobin decrease. Right? If you compare and contrast, it would be easy to remember. So you see this all laboratory test and this all laboratory test is same in case of ulcerative colitis and Crohn disease. So in case of diverticulitis, the stool, if you check the stool for blood, you can get positive and it's called occult blood test. Even occult blood test positive for ulcerative colitis, also for Crohn disease. If in urine analysis, we can get WBC present, right? So in case of laboratory test, the common findings decrease the hematocrit, hemoglobin, albumin, but increase in ESR, C-reactive protein, and WBC, right? So this, they decrease, they increase. So I organize such a way so that student can remember easily. So sometimes it is very important to know there's some risk factor about this disease. What are the risk factor? Risk factor are genetics or genetics, like this disease more common is Caucasian or Jewish descent, or the people who is under the stress, or the people who have a autoimmune disorder, they have a common disease like this. So what the nursing care? Okay, what are the nursing care of ulcerative colitis, Crohn disease, and diverticulitis? So as a LPN or RN, we could monitor for the sign of peritonitis. What are the sign of peritonitis? As I told you, abdominal pain or tenderness, bloating or feeling of fullness, fever, nausea, vomiting, loss of appetite, or diarrhea. So we have to monitor the sign of peritonitis. If any, we could notify healthcare provider. And some books said the sign of peritonitis are rigidity, or sign of peritonitis are rigidity or broad like abdomen, rigid abdomen, rebound tenderness, patient develop fever and tachycardia. So as I told you, in the laboratory study, we can see all electrolyte decrease, folic acid, vitamin B12 decrease. So what is our intervention? We could monitor the electrolyte level. We could monitor input and output chart, because patient has a chance to develop hypokalemia, and hypokalemia lead to dysarrhythmia, and dysarrhythmia lead to cardiac arrest. So if we see any patient get admitted because of ulcerative colitis, Crohn disease, or diverticulitis complication, we give them nothing by mouth. So keep in mind, let me recap. We give the patient nothing by mouth during the acute exacerbation of disease, or ongoing eat food high in protein and calorie. So when we choose the food for them, we always choose high protein and calories and low in fiber, and avoid the caffeine, avoid the alcohol, and also eat small frequent meal. Okay, so just I want to recap little bit about diverticulitis here, this diverticulitis, and I said they have a major complication, the peritonitis. As a LPN or RN, we have to know what are the signs and symptoms of the peritonitis. In laboratory study, we can see that decrease the hematocrit and hemoglobin, but increase the ESR and WBC. Usually we give them antibiotic like metronidazole or some analgesic. As a RN and LPN, as like as ulcerative colitis and Crohn disease, if patient get admitted, we could give them nothing by mouth or clear liquid diet during the acute exacerbation, then progress to low fiber diet. Okay, and also tell them to eat high fiber diet, avoid the seed, nut, and popcorn. So I said, let me recap it, otherwise you miss this one. So nothing by mouth if patient has an acute exacerbation, then progress to low fiber diet. At the beginning, low fiber diet, then ongoing eat high fiber diet. So at the beginning, nothing by mouth if patient has acute exacerbation, then give them low fiber diet, keep continue, and then tell eat high fiber diet. Because the diverticulitis, I said the pouch formation, extra sac formation. If they have a constipation, it will be complicated. Also tell your patient to avoid the food like seed, nut, or popcorn. And majorly important, monitor for the sign of peritonitis, right? Because this peritonitis is a problem of diverticulitis. So I said this is very important for NCLEX board. When you study compare and contrast, it is easy to remember.